This is Rip Snort. He's a 6-year-old neutered male Labrador who we're treating for hip dysplasia and arthritis in both hips, or degenerative joint disease. Rip Snort presented initially for weaknesses of his hind end, noticed by the owner as trembling. He also has mild to moderate pain, as you can tell from the movements in his back legs. He is still limping slightly. In this video, we're 2 weeks out from his stem cell therapy, and so he's actually more comfortable now than he was prior to stem cell therapy. He also has more strength in his hind end. The owners are not noticing as much trembling or weakness. Trembling and weakness is a common presentation for dogs with hip dysplasia because their muscles are taking on so much more of the work in the joint than they should be. The problem with hip dysplasia is that it's an abnormal formation of the hip joint, and the hips subluxate slightly or completely luxate, where the head of the femur comes out of the acetabulum. In Rip's case, he just has subluxation. Over time, that causes arthritis as the joint tries to fuse itself to increase stability. The muscles are also required to take on more of the force of the joint and maintaining it. Here you'll see in Rip's video that he's able to go up and down the stairs comfortably. Prior to stem cell, he was still bunny hopping frequently, but here you can see that he actually uses both of his hind legs independently of one another to take the step down. He's fairly comfortable in his front end, and we actually did his fat harvest from his right shoulder. He's doing wonderfully.